Please welcome to our show Dr. Nakul Karkare, who is an orthopedic surgeon with over 6 million Americans living with replacement hips or knees. He knows the importance of taking care of these joints. Good morning to you, doctor. Welcome to our show.
Good morning, Tony.
All right, so a lot of people have these problems. I mean, for some it's chronic. Tell us, at what point should they start really looking into it?
So if the hip and knee pain starts interfering with their activities of daily living, if it's not getting better, it's time to get evaluated by an orthopedic surgeon.
Okay.
It could be as minor as a muscle sprain, or it could be a ligament to an injury to a ligament, or it could be arthritis. So if it starts bothering you, it's time to get evaluated.
Okay. Now you do surgeries on this, but there's also non-surgical treatments that people can try first?
Absolutely. Before performing surgery, we always try a variety of non-surgical options which are available to us today. Most hip and knee pain gets better with rest, some anti-inflammatory medication, and some physical therapy. What we don't want to do is prescribe narcotic pain medication for this hip and knee pain. We have realized there's a lot of problems with narcotic medication. You can get hooked onto them. Arthritis is a progressively deteriorating condition, so it doesn't get better with time. Unfortunately, it only gets worse, and you can get hooked onto these medications very quickly. You can get onto that slippery slope very fast. Moreover, when patients do need surgery, because they're already on narcotic pain medications, they need even a higher dose after surgery, and then they don't cooperate with therapy, so that's not the best option. If you don't get better with some anti-inflammatory medications, we can try cortisone injections, and that provides excellent relief of joint pain.
But you did bring some models here to just show us quickly about how this process is done.
Sure.
So can you quickly kind of show us the joints here?
Sure. So this is hip joint, and what we do is we remove the diseased part of the bone and put in a cup on one side. This is a model of the pelvis, and on the thigh side we make a hole in the femur, which is the thigh bone, and put in a stem, and then we put it together.
Wow. And then you have a knee model as well, right?
That's right. So again, on the knee side, this is the diseased part of the bone that is removed, and we put in an artificial joint, and then we put the knee back together.
Wow.
Yeah.
That's a pretty intense process, but I'm sure people are relieved once they get this done.
Absolutely. Right? The hip and knee joint replacement surgery is one of the most satisfying surgeries in orthopedics. Wow.
Awesome. Dr. Karkare, thank you so much for joining us. Real quickly, you are from New York, but where can people get more information about you and your work?
My website is newyorkhipknee.com, and I have all the information about hip and knee replacements. That's what I do in life.
All right, there we go. Very important work, helping people out. Thank you so much.